believe I'm the only candidate who has gone on record to say he will vote to repeal Obamacare completely. There are some good parts of it that we should keep. Congress has the right to regulate commerce, so we shouldn't allow insurance companies to discriminate against people who have pre-existing conditions to get insurance. We should definitely allow kids to stay on their parents' policies longer once they're 26 because they're coming out of college up to their eyeballs in debt and they can't find jobs. But Obamacare institutes 10 new taxes on the people at least, and the majority of them aren't on the rich. We think that we're taxing the rich to get lower health care. I mean, if you look at the bill, there's a 2.3% excise tax on medical devices. That increases cost of procedures. It also increases the cost of the prosthetic limbs that our troops need when they come home, and Congressman Carney did not vote to repeal that when it came up. So there's other taxes as well. You're not going to solve this in 60 seconds, but it is a huge tax increase to the people, and we need to get rid of it.
Thank you, sir.
The United States is probably the only industrialized country in the West that does not have some sort of universal single-payer health care. The present system is a stone-complete disaster. There are millions of people out of healthcare, out of work, who have no health care, that need health care. People with existing conditions, because of Obamacare, will have coverage. But this is a stopgap. Now, when they were talking about health care, the public option was available. What they're saying now is the reverse public option, in other words. Like they don't want to have to pay and stay with their high-priced insurance as compared when you could have a public option and have the choice of you want to be on regular Medicare or if you want your private insurance to pay extra for it.
There are many people that I know Congressman Carney has admitted as well that can't afford that coverage. We are going to be forcing people to buy things that they can't afford to make ourselves feel better that we're covering everybody, that everybody's been mandated to have this coverage. We've had allegations of cost savings when we're really just cutting benefits. We need to make sure that people have accessibility to health care and health coverage. We need to make sure that people with pre-existing conditions who've had insurance can transfer that insurance and have that portability. I like the fact that students in 26 can get on their parents' insurance. That's really ignoring the main problem of why the students need that insurance, because the economic conditions don't allow them to have a job.
I have several concerns. The bill is not perfect. It's a huge piece of legislation that involves 16% of our economy. One of the things that I'm concerned about, given my experience on Delaware's Healthcare Commission, is the fact that the individual mandate, we're requiring individuals to purchase health insurance and a certain minimum benefit package, which could require both either taxpayers or those individuals to pay more than maybe they can afford. I think we need to look at that as it is implemented. This is going to be a work in progress. We need to focus mainly on cost containment because it affects our budget like it does.